All right, future pharmacists, welcome. If you're in your first semester, you're going to run into this term a lot. Monophasic liquid dosage forms. Sounds a bit intimidating, right? Don't worry. By the end of this, you'll see it's actually super simple and, well, it's absolutely fundamental. So let's get right into it.
Okay, let's start with a quick question to get you thinking. Picture this. You've got cough syrup in one hand and eye drops in the other. Both are liquids, both are totally clear. So what's the real difference in how they're made? I'm not talking about the active ingredient or the flavor. What's the core pharmaceutical difference? The answer is way simpler than you might think, and it's going to unlock this whole topic for us.
So, the answer to that puzzle? It all begins with understanding one little idea. What we mean by one phase. This whole concept of a true solution is the bedrock for everything we're about to talk about.
Let's actually break that term down, monophasic. It's pretty straightforward. Mono, right? That means one. And phasic just refers to a phase. So put them together, you get one phase. Simple. This is what we call a true solution. It's a mixture that's totally clear, totally uniform. Every single drop is exactly the same as the next, because everything is completely and perfectly dissolved. You can't see the little bits floating around because there aren't any.
And this visual makes it super clear. On the left, that's our monophasic stuff. The best example, salt water. You stir salt into water, it dissolves. Boom, it's one clear, uniform liquid. You can't see the salt anymore, right? Now look at the right. That's biphasic. Think of a salad dressing, oil and vinegar. You can shake it all you want, but give it a minute and it's going to separate into two layers. You can see the two different parts. For this explainer, we're sticking to the left side. The simple, clear, true solutions. Okay, cool. So we get what a monophasic liquid is. But, there are a bunch of different kinds. How do we classify them? How do we keep them all straight? This is where you'll want to pay close attention because it's all about something I call a tale of two routes. And here it is, the number one most important question you have to ask when you're trying to classify these things. Forget the flavor, forget the color, forget even what drug is in it for a second. The key is its route of administration, or to put it simply, where does it go? And that one question leads us to these two big buckets. Everything, and I mean everything we're talking about today, will fit into one of these two groups. Is it for internal use, meaning you take it into your body, like swallowing it? Or is it for external use, meaning you apply it to the surface of your body, your skin, your eyes, whatever? That's it. That's the main fork in the road. All right, let's go down that first path. We're talking about the liquids that are meant to be taken internally. And honestly, you already know a ton of these, even if you don't know their official names yet. And yeah, look at this list. It's a pretty big group. You've got the ones everyone knows, like syrups and elixirs. But then you have things like tinctures, aromatic waters, linctuses. They all have their own little quirks, for sure. But the main thing to remember is that they all belong to that internal use family. So let's zoom in on a classic, syrups. When you think syrup, what two words come to mind? For me, it's sweet and water-based. That's pretty much it. They're what we call an aqueous vehicle, fancy talk for a water base, loaded with sugar. And why all that sugar? It's brilliant at hiding the nasty taste of some medicines. That's why so many medicines for kids are syrups. Okay, now let's look at elixirs. They're also clear, they're also sweet, but there's a huge difference. They're hydroalcoholic. That means they've got both water and alcohol. So you might be asking, why throw alcohol in there? Well, some drugs are just stubborn. They refuse to dissolve in plain water. The alcohol acts like a helper, a co-solvent, to get that drug to dissolve and give us that perfectly clear solution we need. Okay, let's back up and take that other path now. We're switching gears to the second big category, monophasic liquids for external use. Pretty self-explanatory, right? You do not swallow these. They're designed to work on the outside of your body. And wow, look at how many different ways we use these. You've got liniments for sore muscles, gargles for your throat, mouthwashes, and of course, things like eye drops, ear drops, and nose drops. The big takeaway here is that even though they're all simple, one-phase solutions, how they're made is super specific to where they're going. Let's take liniments, for example. You know what these are. It's the stuff you rub on your skin, right? You usually massage it in to create a little warmth. It's all about delivering that pain relief from muscle aches right to the spot where it hurts. A perfect topical application. And here's another great example of targeted external use.
gargles, and mouthwashes. Again, they're monophasic liquids, but they're made just for the mouth and throat. They do their job locally, and then you spit them out. You don't swallow them. And that brings us right back to the question from the very beginning. The cough syrup was for internal use. The eye drops, they're a classic example of a monophasic liquid for external use. See? Simple.
Okay, that was a lot of information, I know. So let's zoom out and boil it all down to the key takeaways. This is the stuff you absolutely, positively need to remember for your exams and, for being a great pharmacist.
So if you remember one thing, make it this. Monophasic means one phase. It's clear, it's uniform, it's totally dissolved. The opposite of that is biphasic. That's stuff like cloudy suspensions or milky emulsions where you can literally see the different parts. Sometimes the best way to understand what something is to be crystal clear on what it is not.
And to make it even easier, here's your cheat sheet. A simple 3-step checklist. Anytime you're looking at a liquid medicine, just run through this in your head. Step 1, just look at it. Is it one single clear phase? If the answer is yes, you know it's monophasic. Step 2, ask yourself, where does it go? Internal or external? And step 3, classify it. Based on that route, you can pop it into the right category. Syrup, elixir, liniment, you name it. Easy as 1, 2, 3.
So I'll leave you with this final thought to chew on. We know now that both a syrup and an elixir are monophasic liquids for internal use. And we know one has alcohol and one doesn't. But what's the next level of difference? What about things like how thick it is, the viscosity, or what preservatives are used? How does solubility play a role? That is where you're headed next in your studies, so keep asking those deeper questions. Thanks so much for tuning in.